Hepatitis C liver disease, caused by the hepatitis C virus, referred to as HCV, can be acute or chronic. Although most persons, 70 to 85%, with newly acquired HCV infection are asymptomatic, most, up to 85%, will go on to have chronic infection. Those who clear the virus on their own are said to have resolved infection. Since antiviral treatment is intended for persons with current HCV infection, it is important to distinguish people with chronic infection from those whose infection has resolved. In recently acquired HCV infection, liver enzymes may be elevated to 200 international units per liter or more. This is depicted here by the enzyme alanine aminotransferase, ALT, shown in blue. Since most newly infected persons have no symptoms of hepatitis, they are often not identified and diagnosed with acute hepatitis C. If symptoms do occur, as depicted by the purple bar, it is usually 6 to 7 weeks after exposure, ranging from 2 to 26 weeks, and they persist during the time when enzyme levels are elevated. About 40% of persons infected will have detectable antibody to HCV, called anti-HCV and represented by the solid pink line, in serum approximately 10 to 11 weeks after exposure, with the percent increasing to 80% by 15 weeks. And virtually all infected persons will present the antibodies by 6 months following exposure. When following up someone with a known exposure to HCV, this is important to keep in mind. Anti-HCV remains positive generally for life. HCV ribonucleic acid, HCV RNA, a marker for viremia, can be detected in the blood with a nucleic acid test, also known as a NAT assay, as early as 1 to 2 weeks after exposure. In patients with recently acquired HCV infection who resolved their infection, liver enzyme levels return to normal and HCV RNA disappears as anti-HCV rises. Antibody tests alone, either rapid or laboratory-conducted assays, cannot distinguish between a recently acquired, chronic, or resolved infection. Chronic infection is characterized by the persistent presence of HCV RNA, shown in yellow, and may be accompanied by fluctuating ALT levels, shown in blue, indicating continuing liver inflammation. ALT levels seen in patients with chronic HCV infection are elevated, but tend to be lower than patients with recently acquired HCV infection. In fact, ALTs can be intermittently normal in patients with chronic infection.
FibroScan, also known as vibration-controlled transient elastography, is used in the context of chronic liver disease, since it enables the simultaneous measurement of two distinct quantitative parameters. The liver stiffness or elasticity expressed in kilopascals, correlated to the amount of fibrosis in the liver. The controlled attenuation parameter, or CAP, expressed in decibels per meter, correlated to the amount of steatosis in the liver. Examination is performed with a dedicated probe placed in front of the right lobe of the liver. Explored volume is approximately 3 cubic centimeters.